In October 2009, the new format of Station 5 will be introduced into the examination. The final section of this video shows a complete new Station 5 encounter, but we will describe the main features now. At the new Station 5, there will be two 10-minute encounters, known as brief clinical consultations. The system content of the station is no longer limited to the 4 specialties represented at the current Station 5, and the encounters can be set in outpatient, acute receiving, or inpatient settings. The emphasis in these encounters is on the demonstration of fluent and integrated clinical skills. Candidates are tested on their ability to solve a clinical problem by taking a focused history and undertaking a targeted examination. This is an important difference from what is expected at Stations 1, 2 and 3, where examiners expect candidates to show a comprehensive and systematic approach to history taking and examination. Candidates will be given 2 brief scenario introductors before entering Station 5. The slide shows an example of one scenario. Note that this scenario is set in an inpatient ward. Remember that New Station 5 is different from the other stations. You are required to take a history and examine the patient at New Station 5. In Stations 1 and 3, you only examine the patient. In Stations 2 and 4, you only talk to the patient. As there are only 8 minutes available, it is not expected and would not be possible to undertake a full, comprehensive history and undertake a systematic examination. Instead, you should concentrate on asking the key questions and performing the most important parts of the physical examination. Have a look at this scenario again. Think of the most important questions to ask this patient. Think what would be the key parts of the examination. As the scenario is set in an inpatient ward, the patient's drug cardex and observations chart will also be available to review in the examination. Let the examiners know you would wish to review them if they are not to hand. In addition, remember that a real patient or a surrogate with no physical signs may be used in the examination. In some centres, particularly where the patients may be less able to speak English fluently, a bedside surrogate will be provided. This surrogate will act as the voice of the patient, and the candidate should take the history from the surrogate but examine the patient, concurrently if they wish. The surrogate will not refer to the patient or act as a translator for the patient, but simply relate the standardised history, answer the questions the candidate poses, and ask the candidate questions that the patient would otherwise have asked. Examiners observe the interaction between the candidate and the patient or surrogate for 8 minutes and provide a warning after 6 minutes that there are 2 minutes left. Remember to answer any questions the patient raises and to explain your management plan to the patient. The examiners are assessing these specific skills. In the remaining 2 minutes, the examiners will ask you about the physical signs you found. If there were none, say so, what your differential diagnosis was, and may also clarify your management plan if you have not made it clear to the patient.